The focused assessment that I'll be completing today is regarding homeostasis. The components of my assessment will include vitals, health history, current health status, medications, lifestyle, and a physical exam to assess symptoms of a fluid imbalance. Some examples of focus assessment findings that would be of immediate concern would be hypotension, tachycardia, and blue skin or lips. And some labs that would need to be ran are blood urea nitrogen, which would be increased, serum osmolality, which would be increased, hematocrit would be increased, serum electrolytes would be low, BUN elevated, and creatinine elevated. And then urinalysis would assess for osmolality, and then we'd assess the color, amount, odor, presence of blood, and the clarity. Two priority client problems that would be of concern would be deficient fluid volume and risk for electrolyte balance. An example of a short-term goal for my client would be for the client's vitals to return to normal levels, and the client will produce a formed stool before discharge. Some nursing actions that would be beneficial for this patient would be to monitor their input and output, ensuring that they're receiving an adequate amount of fluid and producing a normal and expected amount of output for that intake. Also to administer IV rehydration with a provider order. This is a quicker way to introduce more fluid to the circulatory system without it having to go through the digestive tract. So it's improving their circulation, their blood pressure, their heart rate quicker than it would be to drink it, for example. And also patient education, making sure that they're aware of some modifications that they need to make should they have diarrhea, vomiting again in the future to prevent this kind of imbalance, and then also teaching them about food safety. And some interprofessional team members that should be involved would be a dietitian to assess their nutrition and to give them further education about proper nutrition, just making sure that they're getting all of the micronutrients, macronutrients that they need. And then also, like I said, to give them some education regarding food safety methods. They probably are having food poisoning related diarrhea, so that would benefit them to get that education. And then also a provider, PA, NP, doctor, should be involved for putting in orders like IVs, labs, and antibiotics if the diarrhea is due to bacterial infection from food poisoning. And then some assessment findings that would indicate the plan of care is successful would be vitals returning to a normal range, no skin tinting or skin flaking, no dry mucous membranes, urinary output would be increased, and the color and concentration would be lighter and lower. And then the client would produce firmer stools and report the headache going away. Okay, that's it.
Good morning, my name is Mandy. I'll be your nursing student for today. I'm here just to see what we can figure out what's going on with you. Can you just verify your name and date of birth for me?
Yeah, my name is Trinity DeBusk and my birthday is 02/23/2002.
All right, perfect. Let me just so my hand clean. Okay. All right, so tell me what's bringing you in today.
So I've just been feeling awful these past 3 days. I can't keep anything down, and I'm always on the toilet, and I have a headache and I'm nauseous all the time. I can't eat. I think I ate some really bad oysters a couple days ago, and it's just, I'm dizzy all the time. I mean, it was a lot just to come here.
Yeah. So you said about 3 days ago, you're having diarrhea and vomiting, or just diarrhea?
Yeah, I mean, mainly just diarrhea, but if I eat anything, I just get super nauseous.
Yeah. Okay. And it's been pretty consistent for the last 3 days?
Yeah.
Okay. How many times a day would you say that you have diarrhea?
I don't know, probably like 4 or 5 times a day.
Okay.
I don't know, I tend to be on the toilet for a while.
Okay. And is there any blood in your diarrhea?
Not that I've seen, no.
Okay. And then what about your urine? Are you producing a good amount of urine, or do you feel like it's less or more?
I haven't really been peeing that much, honestly.
Okay. Okay. And then as far as your health history, do you have any medical diagnoses that I should know about?
I think I have, I think it's called myocarditis.
Okay. And then what about your exercise habits? Tell me about that.
Well, I'm moderately active, but I haven't been going out much since I got sick.
Right. And then what medications do you take?
I just take a vitamin supplement and allergy meds.
Okay. But no laxatives or antacids, correct?
No.
Okay. And tell me about your diet. What's that like?
Whatever I can get my hands on. Unfortunately, that happened to be oysters, but I mean, I think I eat okay. I try to be healthy. Sometimes I eat some sweets, but everything in moderation.
Okay. What about your salt intake? Do you kind of keep an eye on the sodium that you're eating?
Yeah, I try my best, but sometimes it's just really inevitable. I don't cook with salt or anything, and I try to use low sodium alternatives as much as possible.
Okay, good. All right. So I'm just gonna grab your vitals. Okay, so it looks like you are having some tachycardia, so your heart rate's a little fast, and then hypotension, your blood pressure is a little low. You do have like a slight temperature, so yeah, those are some concerning vitals. I'm just gonna take your pulses. Let's see. Okay, so yeah, your pulses are just a little bit weak. We want them to feel a little more strong. Let's see, I'm noticing that you've got some flaking skin, you look a little dry. Let me take a peek at your mucous membranes. Can you open your mouth for me? Okay, and those are a bit dry as well. Let's see your nails for me. Thank you. Alright, so I've got the data that I need. I'm just going to go report it to the provider, and then I'll come back and let you know what the plan is, okay? Alright.
So as I'm editing my video, I realized that I left out several steps for the assessment. I should have inspected, auscultated, and palpated the patient's abdomen. So for the inspection, I'd have the patient lie supine with the knees bent and feet flat on the bed, and then inspect from several different angles, just looking for any asymmetry, checking that it's convex, checking for any, lumps in the abdomen. And then after that, I can I can auscultate the patient's abdomen, just listening in all 4 quadrants for bowel sounds, and just ensuring that they are a normal frequency, that they're not too infrequent or just you're barely hearing them. And after that, you can palpate, make sure you're doing it in all 4 quadrants, and you're going pretty much over every surface in the abdomen, feeling for lumps and bumps, palpating over the bladder for distension, palpating for any hernias, and checking the patient's like facial expressions and reactions to see if they're reacting to the pressures, if there's pain, and then also asking them if it's painful anywhere. And then you can move on.
All right, so I spoke with your provider, and it does seem like you've got a fluid imbalance. Just your body is getting rid of a lot of water at once, and you're not drinking enough to keep it balanced. So your blood volume is decreased, your heart's working harder than it needs to, your electrolytes aren't balanced, and your body has electrolytes that are important for keeping you healthy and making sure that everything is running smoothly, and they're at a lower level right now because of the diarrhea. So the plan is to keep an eye on everything that you eat or drink, and IVs, and then keeping an eye on everything that you excrete. So including vomit, urine, stool, all of that. We'll keep an eye on that, make sure that it's an expected level and pretty equal. And we'll also be doing daily weight checks. So when you do have a fluid imbalance, you lose your water weight pretty quickly. So if we are noticing a couple pounds of gain or loss, then that can tell us about fluid imbalance. And we'll take your blood. We're going to check for your urea nitrogen level, your serum osmolality, hematocrit, serum electrolytes, and then we'll take your urine sample and check for osmolality, creatinine, and then we'll also look at the color, clarity, odor, and assess for any blood. And then for the plan for you, we'll be giving you an IV with fluids, increasing a lot of hydration. So fruits and veggies are your best friend that has a lot of water content, and we do want you to consume about 11.5 cups of water a day. And then for nutrition and hydration, I'll pop in a little bit and just give you some education on that. Just a general synopsis would be just in the future when you have diarrhea or vomiting, just making sure that you are drinking even more fluid than you normally do, so you can keep up with that fluid that you're losing. Hydrating before and after exercise, limiting your sodium can also affect your fluid and electrolyte balance. So like reading nutrition labels and like straining your veggies is a good way to keep that in check. And I know you said that you don't cook with salt too, which is also a good way to do that. All right, so that is the plan. Do you have any questions or concerns?
Is it just gonna be you and the doctor? Like, am I gonna have to see anyone else about this?
That's a good question. So we'll probably get the nutritionist involved. She can go a little bit more in depth about foods that can help you with your hydration levels, and just kind of assess where you're at right now with your nutrition. But yeah, other than that, I don't have any other concerns for specialist.
Okay. And so the goal is just for me to like get more hydrated and like feel better, because
yeah. So once we get your fluid back up, we can. I mean, that'll make you feel better, obviously. And then when we run the blood work, we'll check and see if it's bacteria or viral. And then we can treat you if it's bacterial. We can treat you with an antibiotic. And if it's viral, unfortunately, we'll just have to wait it out. But yeah, we can get those labs done and get back to you as soon as possible with the results of that.
Okay. All right. Thank you.
All right. Is there anything else you need?
Just to feel better. Stay away from the oysters.
Okay. Well, I'll be back in a little bit to give you some water and your IV. All right. See you in a little bit.
Thank you.